Transfer of care at the hospital. And Art, thank you, because this is a really important point. If you drop a patient at the hospital, you're responsible for dropping patient care information. That means a core set of data about that patient care interaction. If you're using electronic documentation, you've got to leave an electronic patient care. Either your ePCR has got to be done before you leave the hospital, so it's printing off on our printer, or you have to leave a worksheet behind. The worksheet doesn't have to have a complete, long, lengthy narrative, all right, telling me that the patient was carried down the stairs in a stair chair and across to the ambulance and into the stretcher and into the ambulance and the straps were on, all right? But I sure want to know the patient's name, their date of birth, drugs the patient's on, interventions you performed, what patient you found, that kind of stuff, all right? There's a very specific write-up about exactly what that should be, all right? That's a requirement from the state. The other thing that's required, strips and EKGs, labeled with the patient's name. All right, those have got to be there at the time of turnover as well. All right? So if you do paper PCRs, leave us the PCR. If you do electronic PCRs, leave us an electronic PCR worksheet, unless the PCR is going to be done. Any questions about that? Good?
And also, one of your key points in the protocol is that the ALS transferring provider PCR documentation must be delivered to the receiving hospital within 2 hours of the call.
All right. If you didn't hear that, all right, what Art just said is the reminder, all right, ALS transferring provider PCR documentation must be delivered to the receiving hospital within 2 hours of the call. Right here. Okay?
Paper PCR policy statement at the time of delivery.
Paper PCR is at the time of delivery, electronic afterwards, all right? But there's got to be something there when you leave the patient behind. All right? Any questions about that? Really big deal in terms of patient care in all of New York State, making sure that we know what happened before the patient got to us. Really important. All right? Here's actually the documentation of what it must include. All right? Now, can I talk about a bull's teeth?